Latrell for 5 minutes.
Thank you, Madam Chairman. Veteran suicides, we've been parked on 6,000 plus veterans for about 20 years now. That's a fair assessment, correct? Anybody say yes, because that's the number. You should be screaming that one, which is 6,000 way too many. Dr. Scavella, you previously just said we are moving into kind of a more innovative approach on how to address these things. Now, when people read these numbers, they see the number.
Yes, sir.
I'm a researcher by trade before I showed up to this place. You guys are researchers too. We know the underlying factors. We do. And for 20 years, we've known the underlying factors. Is that a fair assessment?
Yes.
So why is it 20 years later we're just now moving to an innovative approach? All right? I say this on just about every single committee I sit in front of the VA, is I can't imagine the rucksack that you're carrying every single day. You two, sitting right there. It's unforgivable. It is. You should be the two people in this room that go to bed every night and get up every morning sick to your stomach because we have 6,000 plus veterans dying every year. It's not a fun job. I understand that. You have these three organizations that are pushing the envelope as best they can. If they didn't exist, imagine what those numbers would be. To my colleague to my right here, and he stated the faith-based, and the organizations, they grow. I think there's more veteran service organizations in America than any other organizations possible. 40,000 or 400,000, it's crazy numbers. When the VA grants these nonprofits or for-profits money, does the information that they gather annually come back to the VA, and does the VA share that with other organizations so they can tailor their processes to be similar or to grow? Either one of you two.
Sure, I'll start and then I'll pass it on to Dr. Burnett. So one of the important factors with this is that we're not being prescriptive to the T for every single program. We're allowing the programs to innovate and to set forth programs that they think will impact the actual community that they're
Does
taking
the VA
care of.
have a portal or an enclave of every single one of the facilities that exists and what's the turnaround time from a call to the VA hotline to Mr. Falk's organization?
Yeah, so if somebody's calling the hotline, they're getting an answer on that call. That's not being called back. That's an actual answer. With regards to the reporting, our teams are getting regular engagement and information back from the organizations that are participating in the program on a monthly basis. And then we're also there for any technical questions and things like that may arise. Is there anything I've missed, Dr. Burnett?
No, I think you captured it, and I think what you're getting at is the foundation of a public health approach to suicide prevention, which is a big part of
The VA should be leading the charge on that. You shouldn't be able to walk across the United States and you should be able to ask somebody who's leading the charge on suicides in America, and the first words out of their mouth should be the VA. That doesn't happen. Congress, I dare say this committee, subcommittee, and committee would most likely give you as much rope as you needed to go out and take this from 6,000 to 0. I think what we're waiting on is for you individuals to come to us and say, we hit 6,000 this year. I'm going to promise that will not be the number next year. I haven't heard that yet all year.
So I didn't hear a question there, but I do want to comment on
That was more of a statement, but
Yeah.
you can respond if you'd like.
I just want to emphasize that this is our top clinical priority, our top priority period, and that we are committed to this work.
How long have you been in this position?
I've been in this position since 2020.
Okay.
2021, excuse me, sorry. But I've been with the VA for my entire career as a physician. I've been committed to taking care of veterans from the time I became a physician. So this is very important to us. We have gotten to this place because we've looked at the data and seen that despite all of our efforts, we do have a large component, 60%, who are not engaged with VA at all. So we're trying to find ways to get to them to make sure that we are taking care of them as well.
That's a perfect point, and I'll close with this statement, but thank you. I don't think we're catching it early enough. By the time those broken bodies and brains show up to these organizations, the round is downrange. I'd like to hear after what the VA working by, with, and through DOD is doing to catch the members as they leave our services so we can get in front of it. Statistically, there's got to be numbers out there that say these problem sets these characteristics, these mannerisms will inevitably lead to, I mean, we're AI-based. There's got to be a way we can figure this out. I'd like to, for a follow-up, if we could get those numbers and know what exactly how the VA is working with the DOD to decrease these numbers. I yield back, Madam Chair.
Thank you, Representative Luttrell.